Hello friends, this is the third video regarding the UPSC CMS interview preparation. So in this we will discuss subject wise panel member questions. So we have already discussed the introduction and the initial set of questions that is asked by the IAS officer. In this we will discuss subject wise questions. So some important thing is that other panel members except IAS will be one medicine faculty is there, one surgery faculty is there, one obs gynae faculty is there, and the fourth one can be either pediatric, either PSM or orthopedic faculty, and any emergency faculty can also be there. So subject wise topic will be asked mostly based on the emergency situations. They will give you clinical scenario and you have to make the diagnosis and also tell the management. Main focus will be on the clinical sign. This is very important. They will ask you all the clinical sign related to any disease and radiological findings and management. So you have to remember each one case in uh, each of the four subjects that you have managed during the internship, because they will surely ask you about this and also ask you how had you managed that case. So you have to be thorough with this answer. If you have not managed any case singly, just do not say that I don't know. Just say that I have assisted with my seniors and I am not able to recall the dose or anything else. You have to be thorough with the drugs and the doses for the common diseases like diabetes, hypertension, thyroid disorders, etc. So for the OPD based knowledge, they can ask you these questions. Learn in detail about the steps of delivery, because they always ask each and every candidate about whether you have performed delivery or not, and they will ask you the steps of delivery, or they can ask you anything related to delivery, whether the precautions, stages of labor, etc. So you have to be thorough with this delivery topic. So according to us, there is no fixed set of questions in the subject wise part of the interview, but we have added the screenshots of the questions that were asked to the previous year students, and these all screenshots are real. And my advice will be that just take out 4 papers for each subject and write the topics from the video only, subject wise, and you will not be able to find these many of the screenshot which are real in any of the video. So just my advice will be to take out the papers and notice the topic. So let's start with the first screenshot. So one of the student is saying that abdominal TB investigation and treatment and scabies. So these questions I think are related to medicine, and scabies is related to dermatology. So they can ask anything related to the 19 subject, but main focus will be on the 4 major subject of the final year. Now, so another student, Dr. N98, is saying that my interview questions are IAS, my favorite branch, and why you have chosen, and the question related to it. So we have already discussed in the introduction that this is the favorite question for IAS, that he will ask about your favorite branch and why. Then in medicine, portal hypertension, spontaneous bacterial peritonitis, hypertension, liver cirrhosis. Okay. In surgery, cellulitis, male urethra structure and urethral structure, and thyroid surgeries. So this is very common topic. In gynecology, they will ask about methods of contraception, vasectomy and tubectomy. Pulse index, pregnancy induced hypertension and diabetes in pregnancy. So next screenshot is uh, name is not mentioned here, but the candidate mentioned that he was asked about dengue mosquito versus malarial mosquito. Okay. Define cardiac arrest versus sudden cardiac death. So this is also very common topic. You have to remember about all the cardiac condition, because these all are emergency and they will ask you these questions only. Diabetic ketoacidosis and management, pyrexia of unknown origin, OBG, management of SSI of LSCS site. So surgical site infection for lower section cesarean section is asked. Management of dog bite in pregnant lady. So this is also very common because we uh, we know that most of the vaccines are contraindicated during pregnancy, but dog bite or the rabies vaccine is not contraindicated. So in pregnancy also we have to manage the dog bite similar to the normal cases only. Another student NN is saying that pain pathway, neuropathy types, cerebral malaria, oligohydramnios, open and closed fractures, and complications. So these are medicine questions. PROM and cesarean section. Okay. First aid, ABCDE. So ABCDE is, it is BLS, basic life support. So this is again medicine or emergency question. Stethoscope uses, this is also medicine question. Bronchial sounds, vesicular sounds, auscultations, and vocal resonance, mitral stenosis, and heart sounds. So these are also very common question. So they will generally ask those questions only which were asked to you in the Viva during your MBBS. Another student is saying that he was asked about abortion, first trimester bleeding, cellulitis, triage, abdominal TB, TB investigation and treatment, and scabies. So scabies is repeated 2 times. Another is saying in ortho, osteomyelitis, X-ray features of osteomyelitis, and Colles fracture and management. So orthopedic faculty can also be there in the fourth position. Generally, there are 3 fixed faculties for obsgyny, medicine, and surgery, and fourth faculty can be pediatric faculty, TSM faculty, orthopedic, or any other faculty can be there. In medicine, hypertension, differential diagnosis of secondary hypertension. Hypertension is in pregnancy. So hypertension is pregnancy is the OBG topic. Side effects of or contraindicated of beta blocker. Focus on differential diagnosis. Hypoglycemia. So these all are medicine question except the hypertension in pregnancy, which is the obsgyny question. Another student Uma Mahesh 22 is saying interview questions are in surgery management of superficial head injury. So superficial head injury can be either extradural hemorrhage, subdural hemorrhage, anything can be there. In other questions are burn, superficial versus deep burn, and the management. In medicine, management of dengue mosquito versus malaria mosquito. We have already discussed this, I think. Yes, we have already discussed this. Then another student is saying the cause of urethral bleeding, swelling in inguinal region. Swelling in inguinal region can be of can have many differential diagnoses. So you should know some of the differential diagnosis. What is Gator's ulcer? Okay, Gator's ulcer is I think venous ulcer. Why ulcer is more common on medial malleolus? So this is again the same question. Causes of non-healing ulcer. So these all are related to venous disorder or DVT or varicose vein, which is again medicine topic, or it is surgery topic mainly. So medicine topics are cause of epigastric pain, how will you manage, how you will examine, okay, and use of auscultation, palpation in detail, how will you investigate. IAS officer, no question. So this is also not good thing that IAS officer is asking you nothing, because this suggests that he is not interested in you. So another student is saying in obsgyny carcinoma cervix, its vaccines. So vaccines are Cervarix and Gardasil 4 and 9, and HPV strains, human papilloma virus strains 6, 11, 16, 18 other strains are also there, and screening and management. So you have to learn in detail about carcinoma cervix. In orthopedic, again orthopedic faculty is there. Osteomyelitis, X-ray feature of osteomyelitis. I think we have already done this. Colles fracture and management. Kalyani, another student Kalyani is saying that IAS officer question from hobby and your internship experience. So internship experience is always asked, which case you have managed or which is your favorite case. Then in gynecology, endometriosis symptoms and management, indication of forceps delivery, obstructed labor, symptoms of obstructed labor, and PCOD. So PCOD is again a very important question that you have to learn in OBG. In surgery that we saw in OT and detail about them depending on that they are jaundice, periampullary cancer, and anatomy of pancreas. In medicine, tetanus, MI symptoms and management. So another important topic for medicine is MI. MI is a very common emergency condition, so you have to remember this also. Another student Shiva Murthy NMA is saying that in Obsgyne define anemia, ICMR guidelines for anemia, first trimester pregnancy anemia, management in first in which anemia iron should not be given. In first trimester bleeding, richest source of iron, thalassemia and pregnancy management, and Menzer index. So Menzer index is generally related with the iron deficiency anemia versus thalassemia, and iron treatment is not given in thalassemia. Surgery questions. Management of 90% deep burns. So they are talking about 3rd or 4th degree burn. Causes of urethral discharge, swelling in inguinal region. What is Gator's ulcer? Ulcer we have already discussed this. Ulcer why more common on medial malleolus. Another student SC is saying that PSM biomedical waste management, surgery into susception management, intestinal obstruction management, pediatric breastfeeding steps, gynecology, common gynae problem, female comes to OPD, white discharge, differential diagnosis. In medicine, MI, again MI is there, clinical feature management, lifestyle modification. So MI can be asked in detail also, so you have to be thorough with this answer. Dhandalya is saying my interview questions are BMI and its importance in pregnancy, severe acute malnutrition, bariatric surgery, different types of COVID vaccines, importance of discipline in life. So COVID vaccine will not be asked nowadays because these COVID related things were asked in 2022 and 23 only. Dr. N98 again saying that my friend interviewed yesterday. I asked what famous about Morbi, his city, his based upon that question take on occupational lung diseases. Okay, surgery, right iliac fossa lump, differential diagnosis, investigation and surgery. In pediatric, clinical case of jaundice with treatment. In obsgyne, PPH and delivery related question. So delivery related question will be there. So another important topic is delivery. Total 20-minute time. Oh, this is not. Another student doctor is saying that my questions are obsgyne carcinoma cervix, endometrial hyperplasia as case scenario and management, and in surgery 25-year-old lactating woman in the postpartum period comes to OPD with the complaint of fever and discharge from the nipple. What is your diagnosis and investigation? Carcinoma cervix, carcinoma breast, clinical feature and examination. So in surgery, another important topic is breast. So this case is related to mastitis. And in pediatrics, a 3-year-old child with generalized edema. What will be differential diagnosis, investigation and treatment? So they generally want to ask about the nephrotic syndrome. Another student Devil I is saying that my interview today, IAS question were related to my state, HP, and Himachal Pradesh, and medicine, high altitude sickness, drugs used in management, arterial stenosis management in eyes. Okay, manifestation in eyes. Okay, and surgery, mass casualty triage. So they can ask you triage. This is also very common question, and because this is emergency based question. Gynecology, AMTSL, active management of third stage labor. This is again very important question. Placenta increta, percreta and management. So placenta increta and percreta generally occur after the previous history of LSCS is there, and in this placenta previa is present. In current pregnancy, placenta previa is present, and in previous history there is LSCS. and then misoprostol. So misoprostol is also very important drug that can be asked. Jay Patel is saying that my medicine questions are common causes of partial seizure in India, neurocystic sarcosis, investigation, treatment, how to radiologically differentiate tuberculoma and NCC, Guillain-Barré syndrome, pyroxia of unknown origin, and investigation. In surgery, my cancer, most common cancer in male in India, so it will be carcinoma lip oral. Rest of the question were based on that only. Okay, risk factors, most common type, and gold standard investigation, treatment, lymphatic drainage of tongue, retromolar trigone, etc. Okay, and method of catheterization of male patient, paraphimosis and its management. So this can be a question in surgery. Then in obsgyne, vaccine given in pregnancy. So this is very common question again. The which vaccine can be given in pregnancy and which are contraindicated. TT vaccine schedule, gestational diabetes mellitus diagnosis, cutoff value according to India, which is DIPSI, and antenatal care of pregnant, anemia in pregnancy. Okay. Another student Tania is saying that first IAS का क्वेश्चन था कि कब पास किया. So पास किया, क्या किया उसके बाद. So we have already discussed in the introduction that IAS will ask this question to everyone that what all you have done after MBBS, and in medicine department में की थी. So डॉक्टर अनकॉन्शियस पेशेंट में कैसे मैनेज करोगे. सो शी वॉज आस्क्ड अबाउट द मैनेजमेंट इन द अनकॉन्शियस पेशेंट, GCS स्कोर, हचिनसन्स प्यूपिल एंड एक्स्ट्राड्यूरल हेमोरेज. गायनेकोलॉजी में डिलीवरी किया या नहीं खुद से. ओके, सो दे विल, आई हैव ऑलरेडी टोल्ड दैट डिलीवरी इज़ वेरी इंपॉर्टेंट टॉपिक एंड दे विल आस्क दिस क्वेश्चन टू एवरीवन वेदर यू हैव परफॉर्म्ड एनी डिलीवरी or not, and if you have performed then they will ask you steps and other anything related to delivery. Preconceptional counseling, basically she wanted to ask about diabetes and folic acid, thalassemia and pregnancy, PSM vaccine carrier, ILR, temperature, freeze test or shake test, and open vial policy. So for PSM, open vial policy or any question related to vaccine will be very common. Another student is saying that can you use in the case back. No. My interview question, IS officer, you are from and famous in your district. So we have already discussed in the introduction part only that they can ask you about your birthplace and the district, famous about your district, and anything related to your states like female infanticide rate or literacy rate, anything can be asked. Recent zoonotic disease outbreak and any other recent zoonotic outbreak disease and COVID. Okay, recent guideline for management of zoonotic disease. So what is the guideline for management of zoonotic disease that Marwa sir have told us, so you can learn from there. Obsgyne, anti-epileptic in pregnancy and monitoring and management with the case scenario. Okay, general medicine, bronchial asthma management and status asthmaticus and pulmonary edema and CVA. Differential diagnosis between spinal anesthesia and epidural anesthesia. So this is the anesthesia based question which can be asked by the surgery faculty or orthopedic faculty. Another student is saying that in surgery most common cancer, we have already discussed this, obstructed labor, partogram, diabetes, scabies. Okay, and also the question are related to DAF. Interview question are Nobel laureates in medicine. So recently in 2018 one Nobel Prize is given for medicine, so you have to know about that. Breast carcinoma, diarrhea management, serious discharge from breast, investigation, and amoebic liver disease. Okay, so Dr. N98, I had my interview today and these were the questions asked from me. PSM, Dr. 98 again, PSM vaccine and different types of vaccine, mechanism of action of mRNA vaccine, management of dog bite. So this is also very common question. Tetanus and dog bite will be very common question for you people in interview. Surgery, enumerate surgical procedures, how to declare the patient brain dead, what to write in notes of the dead patient, Obs Gynae, management of the patient present with the PROM and MS, how to minimize violence against doctors. So this is basic question, how to minimize violence against doctors, and they can ask you a recent incident of the Arjikar College, Kolkata. So you have to be prepared with this answer also. In medicine, common cause of partial seizure in India. We have already discussed this topic. Now, so there are many other screenshots, so I will not discuss each and every one there. So I am just scrolling. Just stop the video and write the topics subject wise in 4 different papers and prepare accordingly, because generally mostly some common topics are there which are asked, so you don't have to prepare the whole subject for this. So I will scroll these one by one, and then you can pause and write subject wise. Just slow the speed to 0.5 in the YouTube, and then you can easily write, or just stop and write it. So there are many other screenshots are there, but we will not discuss here. We will make another video, so that this video will not be very long, and my advice will again be this only, that just these are the subject wise question, and hold the maximum marks in any way. Though marks are given mainly by the IS officer, but we will also he will also observe your subject wise knowledge. So you have to be very thorough with your answers. And so my advice will be there this only, that just write the topic wise question by pausing the video, and just prepare them. These are very important topics. Just prepare them well. For any queries, you can comment below the video only, so that everyone with the same queries will get the answer. And you can like, share and subscribe to our channel for the upcoming videos. And you can also join our Telegram and WhatsApp group. The link will be in the description. Thank you.